I generally ask questions from my previous chapter that I have already taught you. Have you learned? Very good. Do you know the name of this bone? Femur. It is a long bone. What is the criteria of a long bone? It has two ends and one intervening shaft. Intervening shaft, two ends, upper end, lower end, intervening shaft. It is one of the characters. Another, long bones generally oriented vertically. They always lie vertically. Okay? It has a medullary cavity. It has two epiphyses from upper end and lower end. Right? Now, there is another bone you are frequently asked, that is clavicle. Acha, long bone, another character, it transmits body weight. So these are the criteria of a long bone. It has two ends, one intervening shaft. It has a medullary cavity and two epiphyses, and it vertically oriented, and it carries body weight. Right? These are the criteria of a long bone. Now, sometimes, very frequently, this collarbone or clavicle is given to you, and you will be asked what type of bone it is. Is it long bone? Why? Why it is a long bone?
It lies horizontally and it has all the characters of a long bone.
So, actually, I just told you the long bone lies vertically, but it lies horizontally.
Carries the body.
Very good. इसलिए it carries the body weight. Our upper limb weight is transmitted through this clavicle and going to the axial skeleton, and it going through the vertebra and then two limbs and to the ground. Right? But why it is called modified? Because it has, number one, it is horizontally situated, not vertically. That's why it is called modified. Another point of modification is it has no medullary cavity, but within the long bone there is a medullary cavity. Right? Now, body of a vertebra. This body, it is called vertebra as a whole. It is irregular bone, but body is called long bone. Why? Because it carries body weight. Right? That's why it is also known as body only, not processes. It is long bone. Right? Now, tarsal, metatarsal and metacarpal, they are called short bones. Short bones or short long bones. They are called short long bones. What is the difference between this bone, carpal or metacarpal or metatarsal and long bones? What is the difference? One epiphysis, very good. It has only one epiphysis. And that epiphysis is situated towards the head of the metatarsal or metacarpal. Here you see, this is the metatarsal or metacarpal. Tarsal means foot. A tarsal, not carpal. Here you see, their epiphysis is situated towards the head. It is the head, and it is called base. So their epiphysis, one epiphysis that is situated towards the head. But first, this is the first metatarsal. Its epiphysis is situated towards the base. Right? Now, in case of phalanx, their epiphysis is situated towards the base. Sometimes question may come, why first metatarsal or metacarpal is called modified phalanx. It is called modified phalanx because like phalanges, its epiphysis is situated towards the base. This is the answer, right? Now, today our main topic of discussion is the blood supply of a long bone. Blood supply of a long bone. Now, 4 sets of arteries generally supply a long bone. 4 sets of arteries. Blood supply of a long bone. Four sets of arteries supplies the long bone. Number 1, epiphyseal artery. Number 2, metaphyseal. In nutrients. Char, periosteal. Actually, I have written not according to its importance. Most important is nutrient artery. So you should write first nutrient artery, then all other artery you should write. Now, nutrient artery generally it enters into the shaft. If you see, you can see the foramen of the nutrient artery. This nutrient artery, you know the outer covering of the bone is periosteum. So, nutrient artery first pierces the periosteum, then through the nutrient foramen, it enters into the bone, traverses the nutrient canal, and then it enters into the medullary cavity. Medullary cavity. Here you see, it is the opening of the nutrient foramen, and it has traversed the nutrient canal, and it has entered into the medullary cavity. Here it has divided into two branches. Two branches goes towards the two ends, right? Near the upper end, it has again subdivided into a few small branches, and here you see the hairpin like bend. This is most important, hairpin like bend, right? Now, how much this nutrient artery supplies? How much it supplies? It supplies the inner two-third of the shaft. This is the cortex or shaft. Its inner two-third is supplied by nutrient artery. Apart from this bone, it also supplies the medullary cavity also. Medullary cavity contains what? Bone marrow. So, it supplies the inner two-third of the shaft or cortex of the long bone, and outer 1/3 is supplied by the periosteal artery. It is called periosteal artery. I am coming to it later. Now, from where this artery is coming, nutrient artery is coming, from where it is coming? There are so many arteries in our body supplying our muscles or many things. So from there, one of their branches act as a nutrient artery, right? Now second important is metaphyseal artery. Metaphyseal artery. I am drawing one diagram. This is epiphyseal cartilage. This is nutrient artery. It is entering. Now it is dividing into two. Near the upper end, it gives several branches. It shows hairpin-like bend. It supplies the medial inner two-third of the cortex or shaft. This artery shows some what is this? It is not straight, but it is, what is this? Tortuous. Why it is tortuous? Sometimes you may be asked why this artery, nutrient artery, is tortuous. There are several arteries in our body which are tortuous. Number one, this nutrient artery. Another artery, facial artery. Another artery, lingual artery. Uterine artery, vaginal artery. These are tortuous artery. Why it is tortuous? Actually, because of this tortuosity, it lowers the pressure, blood pressure. Number one, when you are moving the bone, it will not be stretched. If there is overstretching, it may be torn. Because of this tortuosity, it will not be overstretched. There are two reasons. It may not be overstretched, and it also lowers down some blood pressure. Now, second group of arteries I will draw, that is periosteal artery. Periosteal artery. Here lies the periosteal artery. Periosteal. Periosteal artery, actually they are the branches of the muscular artery. They are branches of the muscular artery. What it supplies? It supplies the outer third of the shaft. Outer third of the shaft supplied by the periosteal arteries. I have already talked about the periosteum. What is called periosteum? Periosteum is the outer covering. It has got two layers, outer fibrous layer, inner cellular and vascular layer. That cellular layer contains osteoblast cells, so it acts in the deposition of the bone. So if you, due to any reason, if you striped of the periosteum from the shaft of the bone, what it will do? It will cause disruption of the arterial supply. So outer one third of the shaft will be deprived of blood supply, and so it may undergo necrosis, right? At the same time, as it contains osteoblastic cells, osteoblast cells, so it also deposits bone. And that deposition actually increases the width of the bone. Right? তাহলে periosteum actually increase the width of the bone, or this epiphyseal cartilage, they actually increase the length of the bone. Epiphyseal cartilage is also responsible for the formation of the bone. They will lengthen the bone and it will increase the width of the bone, periosteum. If periosteum comes as a short note, you have to write this much. It consists of two layers, outer layer fibrous layer, inner layer inner and vascular layer. It contains osteoblast cells and it deposits bone. And in case of fracture of the bone, it helps in the repair of the bone. Now, and it gives shape to the bone. Function of the it gives shape to the bone. And it also affords surface for the attachment of the muscle, tendons and ligaments. So these are about the periosteum. So periosteal artery coming from the muscular artery. Metaphyseal artery. Metaphyseal artery this artery is coming, actually you will find vascular anastomosis around the joint. When you will study your gross anatomy, you will find there are many circular anastomosis around the joint. So this is known as circulus vasculosus. Circulus, it is called circulus vasculosus. Circulus vasculosus. If you cannot remember this long name, you will just tell it is coming from the vascular anastomosis around the joint. Anastomosis means when 2 or 3 arteries will come and contact together. That is called anastomosis. So from that anastomosis is coming. So vascular anastomosis around the joint, it comes. This is called metaphyseal artery. And they also anastomose with these branches of the nutrient artery. Because of this anastomosis, this part I have already told you, metaphysis is the most vascular part, and because of this vascularity and hairpin like bend, it is prone to develop infection, that is called osteomyelitis. Then come epiphyseal artery. Epiphyseal artery also is coming from the anastomosis around the joint, and it will supply the epiphysis as well as epiphyseal cartilage. It is epiphyseal artery. Epiphyseal cartilage, right? Now, regarding epiphyseal artery, its mode of supply, there are two types of mode of supply. I will show you here. This is called articular cartilage. Articular cartilage. Cartilage. And this is epiphyseal cartilage. Epiphyseal cartilage. What is the difference between these two pictures? Here you see the articular cartilage is continuous with the epiphyseal cartilage, but here there is a gap. There is a gap, but here there is no gap. In that case, what happens? The epiphyseal artery, it enters the epiphysis by passing through the epiphyseal cartilage. It supplies epiphysis as well as the epiphysis. Epiphyseal cartilage as well as epiphysis it supplies, and it is passing through the epiphyseal cartilage. Here you see the epiphyseal artery is actually passing like this, not passing through the epiphyseal cartilage. So which one is dangerous? Out of this, which one is dangerous? This one is dangerous or this one is dangerous? This one. This one is dangerous because if this articular cartilage, epiphyseal cartilage, due to any reason is disrupted, then the blood supply will be stopped. It will get no blood supply because it is passing through it. If there is any displacement, so it will not get any blood supply, so there will be necrosis, avascular necrosis, and there will be no reunion. Sometimes if there is any separation of the epiphyseal cartilage and the diaphysis, it is not joining because of this reason, because that part solely dependent on this artery, and because of this disruption it has become necrotic, right? So there are two mode of supply in case of epiphyseal artery, right? Now, so these are the arterial supply of a long bone, right? Now, each artery accompanied by corresponding vein. You should write this line also. Each artery is accompanied by corresponding vein. Now, nutrient artery also accompanied by nerve, because bones has got nerve supply. So that nerve actually is entering into the bones through the nutrient foramen along with the nutrient artery, and then it will enter into the bone through the Haversian canal, and it will supply. Most of the nerve supply of the bone, they are autonomic in nature. Most of the blood supply is autonomic in nature. Autonomic nervous system has got two components, sympathetic and parasympathetic. So what they supply there? Autonomic, what kind of structure it will supply? It will generally supply the blood vessels. Blood vessels. Sometimes it causes vasodilatation, somewhere it causes vasoconstriction. It is the function of the autonomic. Autonomic function is not to carry painful sensation. Painful sensation is carried by the sensory nerves. That sensory nerve is present. It also carries some fiber which carries sensation, that lies within the periosteum, and in case of vertebra, it is present vertebra, and it is also at the upper end, like here, upper end and periosteum, it has got some sensory sensation. Because of this, I have already told you, if you are asked to drill the bone because of giving traction, first of all you have to anesthetize the periosteum. If you anesthetize the periosteum, then rest of the bone there is no such pain. So then you can easily drill the nail within the bones, right? In my previous class, I discussed about the epiphysis, but I could not complete it. Epiphysis. Now here you see one thing I forgot, the articular cartilage. Articular cartilage means when the bone is articulating with another bone, this part is called articular cartilage. Articular cartilage actually has got no blood supply. So from where it gets its nutrition? Articular cartilage has got no blood supply. Suppose this is the here another bone is here. There is articulation in any joint. You imagine any joint. Here is a capsule, a fibrous capsule, and within the fibrous capsule there is a lining that is called synovial membrane. Within there is a synovial membrane. This violet color is articular cartilage. Here is articular cartilage. Now I am drawing synovial membrane in another color. This synovial membrane secretes one fluid that is called synovial fluid that actually lubricates the joint. That synovial fluid gives nutrition to the articular cartilage, right? So articular cartilage gets its nutrition from the synovial fluid, as well as there is a plexus, synovial plexus. Here is a plexus of vessels. That plexus actually contributed by epiphyseal artery. That plexus also supplies the near the margin. Plexus near the margin, it supplies the articular cartilage. So peripheral part is also gets its additional supply from the capillary plexus of the synovial membrane, right? Synovial membrane actually stops here, from where articular cartilage started. Here it will stop. It will not cover the articular cartilage, right? So you should remember this. If you are asked the shiny smooth portion of the joint, that is articular cartilage, that articular cartilage has got no blood supply, yet how it survives, how it is living. It is living because of the nutrition coming from the synovial fluid, as well as its peripheral part also gets some supply from the synovial capillaries. So these are the now come to the epiphysis. Epiphysis, I have already told you that there are four types of epiphysis. It is very important short note. Frequently it comes to your exam. There are four types of epiphysis. Number one, pressure epiphysis. Pressure. When I am standing, where pressure will be exerted? Here. Pressure will be exerted here. So that epiphysis will develop first. So pressure epiphysis develops first, because when there will be pressure over here, so it is the pressure epiphysis will develop here. It is also pressure epiphysis will develop here. So pressure epiphysis, it appears first. Then number two, traction epiphysis. Traction. Here you see, this is called trochanter. This is called greater trochanter. It is called lesser trochanter. Here, muscle is inserted. One muscle coming from our within abdomen, that is called psoas major muscle. That muscle is inserted here. So because of the pull of that muscle, here also will develop epiphysis. That is called traction epiphysis, because of the traction or pull of the muscles. It will come later. First will come pressure. Right? Number 3. Atavistic. Atavistic. Atavistic epiphysis. This atavistic epiphysis is present in some lower animals because of evolutional process. Our atavistic epiphysis has got no independent identity. In some lower animals you will get independent atavistic epiphysis, but in case of man there is no independent atavistic epiphysis. It has become joined with another bone. To get its nutrition, it has joined another bone. One of the important example is coracoid process of the scapula. If you are given, you will be asked that question. What is this? You should say coracoid process. What muscle is attached here? You should say that muscle is attached here. What type of epiphysis it is? Then you should say it is an atavistic epiphysis. Right? Another atavistic epiphysis example is posterior tubercle of the talus. These are the two examples in case of man. They are atavistic epiphysis. In some lower animal it is independently present, but in case of man it has become attached to another bone for its nutrition. So these are the examples. And fourth, aberrant epiphysis. Aberrant. বানাটা দেখে নিবি, aberrant epiphysis. Right? It is the extra epiphysis. In some bones it may be found. In some bones it may be found. As for example, metacarpal or metatarsal. First metacarpal you may get aberrant epiphysis. So it is extra epiphysis in some bones. Sometimes it is present, sometimes it may not be present. So these are the 4 types of epiphysis. Actually, this is the structurally bone is, what types of bone are structurally it is? Structurally bone is of what types? Spongy bone and compact. Compact bone, if you see, though it is looking at the compact, but it has got porous. It has porosity. This is one of the unit of the compact bone. This is called osteon. This is called osteon. What happens? How bone is formed? Do you know how bone is formed? From which cell forms the bone? There are osteoblast, osteocyte, osteoclast. So out of this, which one forms bone? Bone forming cells? Osteoclast, bone destroying. Osteoblast will develop bone. How? Osteoblast is coming from where? Very good. Mesenchyme. From mesenchyme, due to differentiation, osteoblast will develop. That osteoblast will secrete collagen fiber as well as matrix. It will secrete. that will be later on, that will be mineralized, and when it will be mineralized, it will be transformed into bone. So mineralization is a step of the bone formation, right? So first one layer will be formed, then another layer will be formed. In this way, layer of bone will be formed. Now this will be, if it is concentrically arranged, one layer. Suppose there are 1, 2, 3, 4 layers. So 4 layers, they are concentrically arranged, right? Now between the two concentric layers, between the two layers, there is a space. That space is known as lacunae. So between two concentric layer, there is some space. That space is known as lacunae, right? And within lacunae lies some cells of the osteoblast, while it is forming bone, may be entrapped. वो entrapped हो जाता है. जो entrapped हो गया उसका अंदर, it will form osteocyte. So the cell within the lacunae lies the osteocyte. From the lacunae, some small canaliculi. Here you see, just like worm. Suppose here one layer of bone developed, another layer has developed. In this way, bone will develop. If you arrange it concentrically, it will look like this. One layer, there is another layer, there is another layer. Between two layers, this space is known as lacunae, and this layer is called lamella. This layer is called lamella, and this space is called lacunae. Lacunae. কত টাইম হচ্ছে রে? টাইম ফিরে যাচ্ছে না তো? 46. Now this lacunae contains bone cells, that is called osteocyte. This lacunae, they are intercommunicating. By small canaliculi, they are intercommunicating. These are small space. Through this space, all lacunae are intercommunicated. So this is called lacunae, and this is called canaliculi, right? And this space around which this concentric arrangement, that is called Haversian canal. Haversian canal. This Haversian canal, what it contains? It contains blood vessels, nerve, lymphatics, etc. पहले जो डिस्कस किया था, ये आर्टरी जो गया ना, ultimately it will enter into this Haversian canal, and from Haversian canal then it will enter into the canaliculi, and it will supply like this, right? So this is the lamellar arrangement of the cortical bone. Another canal is there. Actually, it is this Haversian canal is arranged vertically. Two vertical Haversian canal is connected by an horizontal canal, that is called Volkmann's canal. Here you see this canal, Volkmann's canal. This Volkmann's canal, it connects from one. This is called one osteon. It connects another osteon. another osteon, and as well as it also connects exterior. Through periosteum it also connects with the exterior, and internally it may go up to the medullary canal. Volkmann's canal, actually it connects the Haversian canal with the interior, that is medullary cavity, and it also connects the outside, that is periosteum, right? Now how will you distinguish? If you see, how will you identify Haversian canal from the Volkmann's canal? And number one, it is horizontally situated or oblique or horizontal situation, and Haversian canal is surrounded by lamella. Lamella means layer, lamella of bones, but Volkmann's canal is not surrounded by any lamella, right? So in this way you can identify lamella, Haversian canal and Volkmann's canal, right? So these are the cortical structure of the compact bone. The compact bone, if you find this Haversian canal and all these things, you should say that it is a compact bone, right? 2-3 কোশ্চেন এখান থেকে পাবি, 2-3 questions may come. Every month you have to sit for exam. So get prepared. You should not wait for the week. Anytime you have to appear at the exam. So every day you should complete your. You should not leave anything for the next day, right?